Hello everyone, welcome to Dikshant classes. Today I am going to discuss about the remaining types of validity, which is very important used in the researched methodologies. Next is the criteria validity. Criteria validity is set the criteria on the basis of the we have measured the validity, and we what you want to measure it is actually measure it. It evaluates the how accurately a tested measures the outcomes designed to measure. An outcome can be a disease or behavior, performance. Concurrent validity measures tested criteria variable in the presented, while predictive validity measure those in future. It means that the criteria validity is also deals with the disease, behavior, or performance of an of some events, and it measures the criteria and tests and variables in of criteria in the presented, while predictive validity is measured those in futures. Next is to establish criteria validity. You need to compare your test results to the criteria variable. Like in the UGC NET exam, students are compared with the topper who is getting highest marks and who has the highest percentile. Then on the basis of the topper marks, the percentiles of a remaining student will be determined, and also check the scores. Criteria are often referred to as a gold standard measurement. They comprise other tests as a widely accepted and valid measure of constructed. Example of criteria validity. A researcher wants to know whether a college entrance exam is able to predict future performance, academic performance. First semester GPA can be served as a criteria variable, and it is an accepted measure of academic performance. Next is kinds of criteria validity. First is predictive. Predictive means we have to predict the performance of of individual on the basis of some criteria. Like in the UGC NET exam, we have predict the performance on the basis of topper marks, and we have to determine the percentiles of other students of a particular subject. Like UGC general and research paper and research aptitude and commerce. An example of predictive. A predictive validity is a pre-test employment test, and predictive validity when it is actually identified, accurately identified the applicant who will perform well after a given period of time, amount of time. Next is concurrent validity. Is also called criteria related concurrent validity. Concurrent validity measure that your test measures the same way as another test in the same area that has already been proven to be valid. It means that it measures the same in the same way, same method as another test in the same areas, and that has been already been proven to be valid. This type of validity is establishing by the giving a group of the people up to two tested and yours and the one already validated and correcting the scores. Next is convergent validity. Convergent validity means that measuring the same concept with a different methods. It different methods yield the same results, and then convergent validity is supported. Example, different survey item like COVID-19, whether the COVID vaccines are successful for people of India who suffer from COVID-19, and to measure decision and making style closed and open-ended questions are required. Next is discriminant validity. Discriminant validity is a validity which show you that two tests that are not supposed to be the related but in fact unrelated. Next is summary of all the validities. Content validity. Content validity means that does the measure adequately measure the concept. Next is predictive validity. Predictive validity is the validity does the measures differential individuals in as a manner to help to predict the future criteria. Next is face validity. Face validity means that do experts validate the instructions, measures, what is name suggest measures. Next is construct. Does the instrument tapping the concept and theoretized. Next is criteria validity. Criteria validity is a validity in which we have measured the validity on the basis of some criteria. Next is convergent validity. Do two instruments measuring the concept correlate highly? Next is concurrent validity. The concurrent validity is a validity does it measure the differentiated in the manners that help to predict the criteria variable concurrently. Next is discriminated. Next is concurrent validity. Concurrent validity is the validity in which it does the measure differentiated in a manner that help to predict the criteria variable concurrently. Next is discriminant validity. Discriminant validity is the validity where thus the measures have the correlations with a variable that is supposed to be unrelated to this variable. Next is reliability. Reliability refers to the how consistently the method of measuring some things. If the same result can be consistently achieved by using the same methods or under the same circumstances, then measurement is considered reliable. You measure the temperature of the liquid sample several times under identical conditions. The thermometer displays the same temperature every time, so results are reliable. A doctor uses symptom questionnaire to diagnose a patient with a long-term medical conditions. Several different doctors use the same questionnaires with the same patients but give a different diagnosis. This indicated that the questionnaire has low reliability as a measure of condition. It means that the doctors are using the questionnaires of the symptoms. If the doctors getting the same result every time by measuring the thermometer or temperature of a human body, and if the doctors are not giving the same result every time, then it's a low reliability. If they're getting the same result every time, it's a high reliability. Next is difference between validity and reliability. Validity implies extent to the which research instrument measures what is intended to measure. Reliability refers to the degree to which the assessment tools to produce the consistent results when repeated measures are made. Validity mainly focused on the outcome, where reliability mainly focus on maintaining the consistent result. Influencing factors for validity are process, purpose, theory, method, logical implication, etc. Where the reliability, influencing factors for reliability are test length, test score, validity, heterogeneity means different things. Result validity require more research and more difficult to attain. Reliability is comparatively simpler and producing the quicker result reliability is requirement. Validity not a requirement for reliability is reliability is a requirement for validity. Tools. Validity consider prescriptions, where reliability is considered the consistency and repeatability. The utility. The test is completely useless if the findings are invalid. The test is not very useful if results cannot be reproduced. For example, we want to check the marriage impact on the children. If some couples are married and they are not having children, then it is not it will be not completely reliable. Then marriage is reliability where the children are validities, where determine whether the couple have children or not. Thank you so much for listening carefully. If you have any doubt, any query, you should comment in a comment section. I will surely make videos. Thank you so much.